Did you know that a hidden battle is happening inside the bodies of millions of people worldwide every day? This battle is an inherited blood disorder that causes red blood cells to become stiff and sickle-shaped instead of their usual round shape. It is called sickle cell anemia, a genetic disorder that affects the shape of red blood cells. In this video, we will talk about causes, symptoms, and effective treatment options, which will help better understand disease and its management. Sickle cell anemia is a serious and often misunderstood genetic disease. It disproportionately affects people of African, Mediterranean, Middle Eastern, and South Asian descent. It is caused by a mutation in the hemoglobin gene, which affects the production of a hemoglobin protein. It can manifest with a broad spectrum of symptoms, and those living with the disease may experience periodic crises of complications. To understand this, let's talk about the function of red blood cells. In a healthy body, red blood cells are typically round and flexible, which allows them to efficiently carry oxygen from the lungs to various tissues and organs throughout the body. Their flexible and biconcave shape enables them to navigate through the narrowest of blood vessels, ensuring oxygen delivery to cells and removing carbon dioxide, a waste product of metabolism. This shape is crucial for their primary function, which is oxygen transport, and it contributes to the body's overall well-being. Now you are probably wondering what happens to red blood cells in sickle cell anemia. They undergo a significant structural change. Base substitution from glutamic acid to valine occurs at the beta chain of the hemoglobin molecule. Instead of their normal round and flexible shape, these red blood cells become rigid and take on a characteristic sickle or crescent moon shape. This altered shape is primarily due to the presence of abnormal hemoglobin, known as hemoglobin S, in red blood cells. The abnormal, sickle-shaped red blood cells in individuals with sickle cell anemia have difficulty passing through small blood vessels. It can result in blockages, known as sickle cell crises. Sickle cell crises are further classified into 3 types, but before that, if you are enjoying our video and have yet to subscribe, a subscription to the channel would be awesome. Now let's break sickle cell crises into 3 chunks. The first is vaso-occlusive crisis. These are the hallmark of sickle cell anemia and occur when sickle-shaped red blood cells block small blood vessels. It leads to episodes of severe pain, which can affect any part of the body, including the bones, joints, and abdomen. Pain management is a critical aspect of care during vaso-occlusive crisis. The second on our list is aplastic crisis. In this type of crisis, the bone marrow stops producing red blood cells temporarily, resulting in a sudden drop in hemoglobin levels and severe anemia. It is often triggered by infections, such as parvovirus B19, and can be life-threatening, requiring blood transfusions. The last one on our list is hemolytic crisis. This occurs when a large number of red blood cells are suddenly destroyed, leading to a significant drop in hemoglobin levels. Infections or other stressors can trigger it and may necessitate blood transfusions. Sickle cell crisis can vary in terms of frequency and severity from person to person. Various factors such as infection, dehydration, temperature, extreme stress, and physical exertion can trigger them. Despite its widespread prevalence, many are unaware of the hidden complications that individuals with sickle cell face on a daily basis. Repeated blockages of blood flow can cause damage to various organs, including the spleen, liver, and kidneys. Individuals with this disease often infarct their spleen. This condition is called autosplenectomy. It weakens immune systems, making them more susceptible to certain infections. Vaccinations and prophylactic antibiotics are often recommended to prevent infections like pneumonia and sepsis. The other common challenging complication is chronic anemia. It results from sickle cells' reduced lifespan and inability to carry oxygen effectively. Many individuals experience fatigue, weakness, and pallor. Leg ulcers, gallstones, delayed growth, and vision problems are various complications of this disease. It is crucial to bring attention to these complications as they significantly impact the quality of life of individuals living with sickle cell disease. Currently, there is no universal cure for sickle cell anemia, but advancements in treatment have improved the quality of life for many individuals. Medications such as opioids, non-steroidal anti-inflammatory drugs, and pain relievers are prescribed to help manage pain during vaso-occlusive crises and other painful episodes. The other great option for individuals with sickle cell anemia is hydroxyurea. It can help increase the production of fetal hemoglobin, which is a type of hemoglobin that is less prone to sickling. Hydroxyurea has been shown to reduce the frequency and severity of crisis in some individuals. The last resolute in sickle cell anemia is blood transfusions. It increases the number of healthy red blood cells and improves oxygen delivery to tissues and organs. Frequent medical checkups are crucial to monitor the overall health and development of individuals with sickle cell anemia. These visits allow healthcare providers to detect and address complications early. By raising awareness and supporting ongoing research, we can work towards finding better treatments and, ultimately, a cure for this hidden battle. Thank you for watching this video and learning more about sickle cell anemia. Don't forget to subscribe to our channel for more informative content.